Nasikia tu maumivu. Yaani kama ni magoti siwezi teremka pale kwa kama na slopes hivi. Nikitaka sasa kama ni kufanya kitu siwezi inua mikono. Bado ikaanza kuniumiza kichwa. Ilianza hivyo tu ya uchungu tu mwili yote ikaanza uchungu, lakini sana kwa magoti. Magoti ndio ilizidi sasa kupata ile uchungu mbaya kabisa. Kuoga inakuwa ni shida, kupanda mlima ni shida, kuteremka ni shida. Sasa ilienda hivyo tu nikaendelea na madawa, kutumia madawa. Siku hapo nimefika to the point of me kwenda physiotherapy. Sikuwa najua maneno ya physiotherapy ya time. Nilienda na madawa hivyo mpaka nikafika to the point of kujua sasa kuna physiotherapy. Sasa nilienda kwa physiotherapy. Alafu hapo sasa ndio nilipatana na madaktari wenye kujua ndianza kunielekeza kwa pale naweza fanyiwa physiotherapy kama yuko Kenyatta, huko nini nikaenda Kumu, Kerwa, nikafanyiwa huko, nikaona bado haiendi mzuri, nikarudi tena Meru. Sasa wa Meru sasa ndio huko sasa Kenyatta, kutoka Kenyatta sasa nikakuja tena Meru. Na huyu daktari wa Meru pia sasa ndiye alikuja sasa kunielekeza hapo. Akaniambia kuna hospitali nimesikia ni mzuri na bibi yake ameshaenda hapo na ametengenezwa na mikono mzuri. Sasa akanipatia namba ya Dr. Duko, ndio tukaelekezwa tukakuja mpaka hapa.
So Susan came to see us last year with multiple joint pain. She had pain from the neck, shoulders, the back and around the knees, and she had seen very many doctors. So by the time she came to us, she was in a lot of pain, unable to walk, unable to sleep. And because of the pain, it was really affecting her life. She was feeling depressed and discouraged. So when we assessed her, we found that she has a condition called fibromyalgia. So fibromyalgia is very common. What happens is people complain of multiple pains, and then when they go to see a doctor, some are diagnosed with arthritis. They given medication for arthritis, it doesn't work. So they keep trying different things, it's not working. So by the time when they come to see a pain specialist, we're able to make the diagnosis because there are certain symptoms they come with. Some of the symptoms they usually mainly complain about are this pain in those specific points. And those places we call them trigger points. So they complain of pain behind the neck, around the neck, going down to the shoulders, then around the shoulders, in the upper back, the lower back, around the hips, and then behind the knees. And some of them also around the ankles. But when they are investigated, they do x-rays, they find that there is no signs of arthritis. And so when that happens, we make a diagnosis of fibromyalgia. So when we examine, like how when we examined her, she would feel some tough noodles. If you were to hold your hand like this, and you feel those two tendons in the bones, you feel some hardish, like you'd feel your bone or some hard tendons. So on the back, on her neck here and the muscles, there are very tough points which are very painful. And so when you press on that part, the patient will scream in a lot of pain. And so that will tell us that patient has fibromyalgia. So we first started with medications, which are the typical medications, ordinary painkillers, but then now we give painkillers that target the nerves. The condition in fibromyalgia affects the muscles and the coverings of the muscles, which we call in medical language fascia. So those coverings, like for you to give an analogy, when you slaughter a goat, you know when you separate the skin from the muscle and you pull it up, you see that layer that is almost mucus-like. That layer, that soft material is called fascia. So now between that and the muscle, that is where the pain is originating in patients with fibromyalgia. So when they have that pain, they have those tender points in the back of the pain, in their back and around the neck. And so for her, what we did is some of those points are very painful. So we did some injections to help to relieve that pain. And so when we did that, we gave her some time off, like 2 weeks, and we continued with nerve medication, which will help to relieve the pain. So then when we saw her at 2 weeks, we were able to review and see she actually felt better. In fact, on that very same day, when we did those injections, she noticed a pain, almost like a 70% pain reduction. But what usually happens with chronic pain, patients usually are in pain for a very long time. She had been struggling with pain for several years. And so that pain, it's not like it's a magic bullet that you take something and then it goes away. With chronic pain, one of the things we are able to discuss with Susan is we're able to talk about what are the things that you're struggling with. She was saying, I can't walk from here almost 100 meters, it would be too painful. I struggle going to church. I'm not able to sleep well at night. I keep turning in bed because I'm in a lot of pain. And so when we're treating, we're saying, let's start with goals. Let's see what are the things that you can be able to do. So one of the things we notice is that her pain, she noticed an improvement specifically in function. Some of the things that were a struggle, like a sleep, she was able to sleep well. So these things of waking up in the middle of the night because of pain slowly reduced over time, and she was able to sleep through the night. She would sleep and wake up rested. So that was a very big milestone. That she's able to go and walk some distance, even 500 meters, and she was able to do that. One of the other things that would happen is that she was complaining a lot of brain fog. So you find like you forget very quickly, or you just feel like you're thinking in slow motion. You know there's something you've been asked, I know the answer, but then it's taking some time to come. And so with medications, this nerve-like medication, it helped to reduce that brain fog. And so her memory slowly improved. The other thing that we do with fibromyalgia, it's very important to work together as a team. And one fortunate thing we have in the clinic is that she's being treated by several members of the team. We have our psychologist who's able to help her and her husband cope better. So they'll have conversations about what are the things that they can do to help her adjust. She'll be able to talk about any stress that she's having and what are these triggers. And then with the husband, we're able to figure out how to avoid those triggers. So our psychologist, Dr. Elizabeth Moy, is very, very good. And they were able to have several conversations, and they still continue to have those conversations. She was also being seen by a physiotherapist, because physiotherapy is very, very important in fibromyalgia. We want this patient's function to be restored back to normal. And so physiotherapy, specifically targeted for that, really helps. So they did a lot of interventions to help relieve pain. And then also with the orthopedic surgeons, we were able to see what are the other things that are making her comfortable. And throughout this process, we were able to discover that she was having a problem with her knee. And she kept complaining and saying, when I walk, sometimes I would feel like my leg just gives way. And so when we examined her, we found, wait, she tore a tendon called a meniscus. And one of our other team members, Dr. Mbogo and Dr. Mbuku, were able to do this surgery on her, which was done last month. And now when she's come later, she's much, much better. It's 1 month since the surgery. And so we thank God that we're able to work as a team to be able to see how to assist Susan. And so it is a joy for me to see that she's able to go back to life, her normal life. Like today she's saying, when I'm done from here, I'm going to visit the agricultural shop, which is here in Machakos. So before a year ago, that is, she'd be too exhausted by the time she's seen us. She just wants to go and sleep. Now she's able to engage with people and do things. She's going for weddings and other things and able to sit through services. And that's a joy for us.
This is the best hospitali nimeiona, sababu nilipoanza hapa nimeona mimi sasa niko na mabadiliko makubwa sana, na ni watu wanajua kufuatilia watu, na tena ni watu friendly. Hata kama huyu daktari simuiti sasa, hata dokta mimi namuita mama, naona sasa ako na madli la. So ukikuja hapo unajua hata ukiwa unahudumiwa hata na daktari na kuhudumia na ile nini ya upendo wa mama ama wa baba ama wa kusympathize na mwenye ako na uchungu ama mgonjwa, unajua hata unasikia umepona hata kabla hajakuattend. So hii hospitali naona ni hospitali iko na huduma ya kutoka kwa mandawa, kwa devices, hata wenyewe wanakuelekeza hata ile ni wajui, na sio lazima wakuandikie mandawa. So wengine wanasema ni vile watu wanataka mandawa yanunuliwe kwao, anakuandikia unaenda kununua anywhere.
The goal with treating fibromyalgia is what are the things that we can do to get you back to normal, and even if it's not normal, at least near normal. So we are wanting to see how we can restore your function. So what are the things you're struggling with? Are you struggling with work? What type of work are you doing? You may not necessarily go to dig a farm, but you can be able to reduce your pain, that you can go and supervise workers or people who are farming for you. You are struggling with walking, you're able to walk. You are struggling with sleep, now it is getting better. And so we tend to focus so much on the pain, and when this pain takes long to come down, people feel discouraged. And so the message we tell our patients is, our goal with all this treatment is to restore your function so that you get back to where you were.